Guys, look at this question. 3 classes of immunosuppressants used in transplantation with one example for each. Mention 3 classes of immunosuppressants used in transplantation. So you're talking about what? Organ transplant here. Okay. So for this, what immunosuppressants will you give? Okay. 3 classes of drugs with one example each. They have asked this only for 3 marks. So let's get quickly to it. Right. So the drugs that you should know for transplant: antiproliferative drugs like azathioprine, mycophenolate mofetil. Okay, don't talk about methotrexate. So antiproliferative drugs, what do? They inhibit lymphocyte. Okay, they inhibit lymphocyte proliferation. Okay, by blocking DNA synthesis. Okay, so we talked about antiproliferative drugs like azathioprine, mycophenolate mofetil. So look at where actually the action here is. So here mycophenolate they are showing here, and the mycophenolate they are showing here, guys. So see if you can understand. Okay, now let's move on to the this is the T cell. They're talking about T cell. Okay, this entire thing is a T cell. That's what I'm understanding. So this T cell here. So but they talked about lymphocyte proliferation, T lymphocyte, that is right. Okay, then one is done. Next, calcineurin inhibitors. Example is cyclosporin and tacrolimus. So what this does, again some T cell signaling it is inhibiting, preventing lymphocyte activation and block cytokine transcription. T cell, lymphocyte, cytokine. This 3 separately they are talking about. Inhibit T cell signaling, prevent lymphocyte activation, block cytokine transcription. Okay, cyclosporin, tacrolimus. So look at this here. Where is calcineurin inhibitor? Here, cyclosporin. Some word is written here. Okay, fine. Now let's go to the third one, guys. Third one we will see is glucocorticoids. Example, prednisolone. This will do almost everything, but it won't inhibit or anything. It will just decrease action of everything. Decreases phagocytosis, releases some proteolytic enzymes, decreases lymphocyte activation and lymphocyte proliferation, decreases cytokine production, decreases antibody production. Okay, so cytokine and antibody production is reduced. So all these excess don't go and attack. That is what we are telling. Don't create so many things that will go and attack. Okay, just suppress the immune, right? Because we want to transplant something into this person. Okay, don't reject it. That's what we are trying to do. Okay, so now let's move on. So we are done with 3 classifications: antiproliferative agents, calcineurin inhibitors, and glucocorticoids. Let's move to the fourth one now. Okay, the next one you will talk about is polyclonal antibody, antithymocyte antibody, antithymocyte antibody. So it is an antibody, antithymocyte antibody, and this is an antibodies to cell surface proteins deplete or block T cells. So again something to do with T cell, deplete or block T cell. So let us see where this. Do you see this ATG somewhere here in this diagram? No. Okay. No problem. Let's move on. Basiliximab is the next one we need to know. Basiliximab. It is an IL-2 receptor antagonist. So on an activated T cell, you will have a receptor for IL-2, right? So you will have IL-2 receptor antagonist. This one is an IL-2 receptor antagonist, basiliximab. MAB means monoclonal antibody, right? MAB means monoclonal antibody. It is directed against the CD25, which is I think in the IL-2 R alpha chain, okay, which is expressed on activated T cells. So basically IL-2 receptor antagonist, basiliximab. Let's see if it is there in that diagram that we wanted. I mean, we have just found this somewhere, but I don't see basiliximab here. Okay, no problem. So last one, guys, don't worry. Let's go to the last classification that we should know here. This one, belatacept co-stimulation blocker. So this one, belatacept, it selectively inhibits T cell activation. Again, T cell something. Blockade, how does it selectively inhibit T cell activation? Through blockade of CD80, CD86. So belatacept is here. CD80, CD86 blockade, it blocks this so that the T cell activation is selectively inhibited. Okay. Belatacept, co-stimulation inhibitor or something, selectively inhibits T cell activation through blockade of CD80, CD86. Okay. So this is all about immunosuppression drugs classification, especially for transplant. Note that we are not writing methotrexate in the exam. Okay. Now, when you do transplant, do you only rely on immunosuppressants? No. You will also do a pre-transplant testing of HLA, right? HLA matching and all you do, right? I hope you know this. Okay. So, there are many types of rejection. There can be a hyperacute rejection, which happens hours to minutes to hours. Okay. Hyperacute rejection, minutes to hours, right? As soon as you give, it is rejected. Acute cellular rejection, acute vascular rejection, which is these two are around 5 to 30 days this can happen, and then you have chronic allograft failure. So the rejection that the immunosuppressants are trying to prevent or avoid are these two, acute cellular rejection and acute vascular rejection, 5 to 30 days which occurs, right? This one is trying to be stopped by these immunosuppressants. Okay. Okay, so now tell me the classifications you learned. Antiproliferative drugs, azathioprine, mycophenolate mofetil, calcineurin inhibitors, cyclosporin, tacrolimus, glucocorticoids like prednisolone, ATG antithymocyte antibody, which is a polyclonal antibody, then besiliximab, which is an IL-2 receptor antagonist, and belatacept, which is co-stimulation blocker, it says. Okay.